All kids need is a little help, a little hope, and someone who believes in them. Quoted by Magic Johnson. Hello, myself Sakshi Dhoran from CPW World. Today we are at Mannsparsh Neuropsychiatric Clinic, which is located in Bail Bazar, Kalyan West. Here we are going to meet Dr. Nicky Sayla, who is an occupational therapist. So let's go inside and meet her. Hello.
Hi.
How are you doing?
I'm good. How are you?
I'm fine. Okay, so very first of all, tell us about yourself.
Hi Sakshi, my name is Dr. Nicky Sayla. I'm a pediatric occupational therapy doctor. Yes, I treat patients with developmental disabilities. The age range is usually from 1 to 22. There are various developmental disabilities like autism, attention deficit hyperactive disorder, Fragile X syndrome, Down syndrome, cerebral palsy, etc.
Okay, could you elaborate what exactly special children is or what occupational therapy is all about?
So, occupational therapy is a branch of medicine where we treat patients to make them independent in their daily living things. Okay, whatever is the diagnosis of the people, we try to make them independent and reach their highest functional level of independence so that they can perform their daily living tasks. So, if I give you example, OT work in different fields. Like orthopedic, example if the people have fractures or they have gone through recent accidents, etc. Any hand injuries, elbow injuries, shoulder or joint injuries, muscles injuries, etc. There the OTists work in preserving their range of motions, helping them with their muscle powers and splinting, etc. Modifying their environment and all. The other branch is working with psychiatry. So in psychiatry, we have both the adult patient and the children's as well. So in adult, we usually see schizophrenia, depressions, etc. Then the branch comes of around cardiorespiratory. So cardiorespiratory mein again we work on how we can make the patient independent, though their cardiac condition or the respiratory disorder. Then we work with pediatrics. So in pediatrics, we usually see neurodevelopmental disorders or psychiatry cases, which example I gave you, which pediatric conditions I am working with. Then OTists also work with hand. They are specialized only in hand, जहाँ पे many of the patients have bones का issues या फिर muscles का issues या फिर hand में some type of diseases. Okay. We also work with neurological conditions जहाँ पर कुछ नर्व पाल्सीज हो गई हैं, स्ट्रोक हुआ है पेशेंट को रिसेंटली. ओके, तो वो सभी प्री और पोस्ट ऑप केसेस, प्री ऑपरेशन एंड पोस्ट ऑपरेटिव केसेस पे वी वर्क. एंड रिहेबिलिटेटिव अप्रोच रहता है, कंपेंसेटरी अप्रोच रहता है. वी एडुकेट द पेशेंट्स एंड फैमिलीज, वी काउंसिल देम ऑन व्हाट शुड दे डू, हाउ शुड दे प्रिवेंट देमसेल्व्स फ्रॉम फर्दर इंजुरीज, एक्सेट्रा. सो देर आर मेनी अप्रोचेस बेसिकली वी वर्क ऑन. इन पीडियाट्रिक्स आई वर्क on usually sensory integration based approach, neurodevelopmental treatment, play based approach, cognitive based approach. So these are just various approaches which I am telling you. So this is a short which I have told you about what we do. Yeah.
You share your work experience with us.
So Sakshi, currently I am working at neuropsychiatry hospitals and clinics. I am also associated with one not-for-profit organization.
Okay, that's great. So you are dealing with special children.
Yeah, pediatrics.
You are treating them.
Yeah.
So what exactly you are doing or how you treat them?
Okay, so I guess you would understand from my smile. So treating pediatric is already, it's very hard, and especially when you treat on some special kids who have different abilities, who are very different from us. जैसे I explained you what kind of diagnosis I am seeing right now. So there are various diagnoses, there is intellectual disabilities and all. So it is very hard to deal with these kind of patients, but as I told you, you can see from my smile, because the results are very amazing. And trust me, the patients are super amazing. Like during this course, I am seeing so many variety of cases. Every individual is different, though they have same diagnosis, but their characteristics are so different. And even I am amazed at looking at these people and their parents, because I really understand it is so much traumatic for a parent to understand that their kid has a disorder or disability by birth, not even a disease जो तुरंत क्योर हो जाए, but there is a disability or disorder which is going to stay lifelong. So I can understand what trauma the parents are going through, but still the parents are whatever is their situation, environmental barriers, social barriers, economical, physical barriers, mental barriers, जो भी barriers है parents के, still they are overcoming their all and bringing the children, they are upcoming, bringing the children for the treatment. So that's a very great point, and now parents are also knowing how to deal with these kind of cases. So I am very happy that I am working for these kind of children, because ये बहुत rare है, and we do not get much professionals working in these areas. So ये मेरे parents and patients ही motivate करते हैं मुझे to bring on that smile on me, because they only keep on telling me that मैडम अब ये improvement हुआ है, आपने ये चीज़ें बताया, अब ये हो रहा है, अब बच्चा ये कर रहा है, या अब बच्चा मुझे देख रहा है, अब बच्चा मुझसे बात कर रहा है, बच्चा involve हो रहा है, या something kind of that. So those things are extremely, they bring lot of happiness. So I am very proud that I am bringing smile on many faces. So
That's really great.
Yeah.
So now just share any experience with us.
I'll share you one general experience and one per case also. So actually usually this happens that whenever a parent is coming, either of the parent is crying when they come for first meeting with me, for first assessment, because then they realize कि अभी diagnosis है and everything. So some of the other is crying, and down the line when I meet them up for follow up, so then they are crying at least out of happiness. First they are crying out of depression and all, but then they are crying out of happiness, which actually makes me feel successful and the parent as well. So this was just general, I am telling you. And cases per se, so I have many cases to discuss, and our interview can go on and on. Okay, so I'll give you one example of the case. So there are many of the parents with similar kind of complaint that the kid is hyperactive, kid is not looking at us, not listening to us, not responding, not speaking, okay, and just flapping their hand, flapping their leg, sleeping on the wall, sleeping on the ground, touching all the walls, snatching everything from people, or whenever they see people, they are very afraid and they go back into a room, or they just start crying whenever they hear noises, etc. So I recently, these were the concerns from one of the case. So abhi down the line we have done the around treatment for around 2.5-3 months. So now the parent was like कि madam, we can take him to some social gathering. अब वो लोगों से नहीं डरता है, पहले लोगों से डरता था, घर के बाहर ही नहीं जा रहा था, अभी लोगों से नहीं डरता है, बिल्डिंग में हमारे जो फ्लोर है उस पे जाता है, इनफैक्ट नेबर का डोर भी नॉक करता है एंड उनके घर में भी जाने देखता है, एंड सोशल गैदरिंग भी उसने अटेंड करना शुरू किया है. एक बर्थडे था जिसमें वो गया था एंड ही वॉज हैप्पी, लाइक वो एक कॉर्नर में नहीं बैठा हुआ था, ईयर्स क्लोज नहीं किए हुए थे, एंड वो लोगों को देख रहा था एंड ही वॉज स्माइलिंग, आई मीन ही वॉज हैप्पी. सो दिस इज़ अ वेरी बिग थिंग फॉर अ पेरेंट कि जब उनका बच्चा कुछ तो चीज़ें कर रहा है, एंड इट इज़ अ गुड थिंग फॉर अ चाइल्ड ऑल्सो, बिकॉज नाउ ही हैज स्टार्टेड हैविंग फन he is participating in one environment. So I think even the child was very happy. So this was just a very short case that I discussed with you, but even to reach till this 2.5 months and to achieve this kind of goal where the child is present in the social environment was a very big and tedious work. So it took a lot of efforts, but yeah, this happened and there is a lot of progress. I see many kids that have started speaking in sentences, they are playing with the parent, they are going to school, they have started attending schools, understanding what a person is telling them. So these things have started. Also the functional independence, what I was talking to you about earlier. So there are kids that we have worked separately, कि वी हैव सेट आवर गोल्स, हमने सेपरेटली काम किया है कि अभी ईटिंग अगर एक पेरेंट का गोल है कि पहले बच्चा खुद से खा ले एटलीस्ट तो भी हमारे लिए हेल्पफुल होगा. तो वी हैव सीन मैनी केसेस जहाँ पे ईटिंग इंडिपेंडेंटली हैज़ बीन अचीव्ड. ड्रेसिंग, अनड्रेसिंग, देयर आर टॉयलेटिंग. तो ये जो फंक्शनल काम है दिन के, ऑब्वियसली टॉकिंग, गोइंग टू सोशल गैदरिंग्स एक्सेट्रा, तो ये फंक्शनल जो गोल्स हैं ये थोड़े थोड़े अचीव होने लगे हैं about particular cases, and many cases are there जहाँ पर अभी down the line of the course अभी काफ़ी चीज़ें अचीव हो गई हैं. And I have also discharged those patients and just given the home program for the parents to continue. एंड काफ़ी स्ट्रैटेजीज उनको बताई जाती है कि अगर आपको ये सिम्टम दिखता है या ये बिहेवियर दिखता है बच्चे में तो आपको क्या करना है. And so many patients are happy now and they have been discharged from OT and they have got good results. Yeah, but also there are many that we are working day and night with and it is hard to deal with them, but still with the hope that we see good results and we help them. So that's the hope.
Just now you were said कि it's very hard to deal with them. So आपकी mental health, आपका जो भी आपकी तबीयत, ये सब आप कैसे संभालते हो?
So I really like your question because very rare the people think of us also about our mental health, because physical health is seen by everyone, but mental health के बारे में लोग वैसे ही बहुत कम बात करते हैं. And not only in India but all over, I would say like really all over लोग बहुत ही कम बात करते हैं mental health के बारे में. सिर्फ हमारा नहीं, I guess सभी professions, even your profession might in your way would be very tough for you. So my mental health, so actually I'll tell you, this is a real like every day this happens, that whenever I go to sleep uske pehle I'm actually thinking about all the patients, and this really happens because constantly वही चलता रहता है कि इसका आज ये अच्छा रिजल्ट आया, इस पेशेंट के ऊपर हमको ये चीज़ पे काम करना है, पेरेंट को कैसे हम काउंसिल करें, कौन सी चीज़ें बताएं, ये पेशेंट के साथ किस तरह चल रहा है, अरे इसके साथ ये नहीं हुआ, क्या अदर वे फिगर आउट करें कि हम उस पेशेंट को हेल्प कर सकें. तो ये थॉट कंटिन्यूसली चलते रहता है टिल आई गो टू बेड. एंड एक्चुअली इवन दिस थॉट हेल्प्स मी टू मोटिवेट सुबह का अगेन स्टार्ट माई डे. And मेरे mental health का then I take care by doing the things which I love, going to my hobbies or talking to my favorite people. So there are 5-6 of my favorite people which I love to talk to them, and I talk to them. I listen to music, also kind of self-reflect, because that I think that is a major point which comes. So I self-reflect on my thing, that whatever has happened throughout the day, also what were my achievements and what are the difficulties. So even maintaining the records of those things helps me to keep my brain all clear and work again for the next day.
I really appreciate you, because at the age of 24 you have achieved so much things, and like earlier you just told us the treatments and all those special children's and therapy. So it is really hard to deal with them, like at the age of 24 it is very difficult. So I'll just ask you, can you give any advice to these parents or special children's siblings or their family, you can say overall in general society?
So there's a big, not a suggestion, not an opinion, but and definitely an advice for the society, for the parents, that please start accepting these kind of kids. Start loving them, because it's not their fault that they are into these categories, or it's not anyone's fault for that matter. So please start accepting them. Once we start accepting them, they definitely respond to us. Once we start loving them, they definitely show that much care and love for us. So if we accept them and give equal status as of ours, like अगर बच्चों को स्कूल में equal status मिल रहा है, like अभी तो schools भी divided हैं, अगर schools inclusive हो रही हैं, if the society is being neutral towards them, you know, because I have heard काफ़ी लोग just बोल देते हैं, अरे ये बच्चा पागल है, अरे इस बच्चे को ये डिफ़िकल्टी है, ये बोलता नहीं है, विच क्रिएट्स लॉट ऑफ नेगेटिव इम्पैक्ट वो फैमिली पे, वो बच्चे पे. वी थिंक दैट द किड्स आर नॉट लिसनिंग बिकॉज दे आर नॉट रिस्पॉन्डिंग, बट इट्स नॉट लाइक दैट. दे अंडरस्टैंड मेनी थिंग्स, दे अंडरस्टैंड द वाइब्स, दे डू अंडरस्टैंड आवर वर्ड्स. Definitely their understanding, way of understanding and responding is different, but that doesn't mean the society should pressurize them or keep them isolated. So it is very important for the society to accept them and start loving them. And the same advice would be given to the kids, that whatever is the status, if people are accepting you or not, just be proud of yourself, because these kind of patients have some special abilities which many of us do not have. So they should just focus on their abilities rather than disabilities, and take that as a strength and work ahead, because there are many opportunities down there and they can actually make great changes.
While treating these children, what precautions you take?
So Sakshi, usually when the kid comes, they are crying, they are shouting, many of them hit, bite, there's a lot of tantrums, there are a lot of behavioral issues. So I have to be that much prepared that I protect myself as well as the kid, as well as the caregiver or the parent who is with us during the treatment plan. So we have various strategies, behavioral modification strategies or some cognitive strategies that we tell the parent, and we also try implementing those on the kids, okay, so that they can regulate themselves and they can adapt to the environment at their best functional level. Many times I have to modify the environment according to the patient's need and their likes. Okay, so that the patient can function better in that environment and is calm, so that then we start upon the treatment.
I really appreciate you, because at the age of 24 you are dealing and you are going through all these things. You are treating special children, because there are not many professions out there who help special children, or there is not much awareness about special child. So I really appreciate you, and doing all those things you also keep that children alive inside you. So I really like that thing. So I'll just say all the very best, and thank you so much.
Thank you, Sakshi.
सबको मेरा नमस्कार. मेरी बच्ची है जो ऑटिज्म से पीड़ित थी, और शी इज़ वेरी स्मार्ट एंड एक्टिव. हम जब डॉक्टर को अप्रोच होने के बाद ऑक्यूपेशनल थेरेपिस्ट मिली हमें, और उस ऑक्यूपेशनल थेरेपिस्ट की वजह से मेरी बच्ची धीरे धीरे नॉर्मल हो गई है. और मैं वो ऑक्यूपेशनल थेरेपिस्ट निकी मैडम को थैंक यू बोलना चाहता हूँ कि उन्होंने मेरे बच्ची को अच्छे से ट्रेनिंग देके कुछ लिमिट तक नॉर्मल लाया. अभी हम उसके सिटिंग टॉलरेंस के ऊपर वर्क कर रहे हैं, और मैडम उसके ऊपर काफ़ी वर्क कर रही है. तो ऐसे जो डिजीज़ है, ये ऑटिज़म का डिजीज़ काफ़ी ये रेयर डिजीज़ है, और काफ़ी लोग आगे आने के लिए डरते हैं कि इसका इलाज कैसे किया जाए. और करते हैं तो कभी गलत जगह चले जाते हैं। तो उन पेरेंट्स को मैं रिक्वेस्ट करना चाहूँगा कि आप प्रॉपर डॉक्टर की तरफ जाओ और प्रॉपर ओटी स्पीच थेरेपी आपके बच्चे को मिली तो सही में ये जो ऑटिज़म है इसके ऊपर मात कर सकते हैं। मैं फिर से मेरी बच्ची की जो ऑक्यूपेशनल थेरेपिस्ट है उनको धन्यवाद देना चाहता हूँ और डॉक्टर्स को भी धन्यवाद देना चाहता हूँ। और पेरेंट्स आगे आए, ये बच्चे सही में यदि प्रॉपर डायग्नोसिस हुआ और प्रॉपर इलाज हुआ तो ये ठीक हो सकते हैं। थैंक यू वेरी मच।